Hello, everyone, and welcome to today's press conference. Today's press conference regarding the tragic deaths after plasma harvesting at Grifols sites. Today, we're going to have spokespeople from the Manitoba Health Coalition and the Ontario Health Coalition who are responding to the sad news of two deaths of paid donors at for-profit plasma collection facilities owned by Grifols. The coalitions have long raised warnings about safety and the ownership and control of the blood system. So before we begin, I just want to note that we're going to hear from our four spokespeople, and then afterwards we're going to move into a question and answer section with the media. During that portion, if you'd like to ask a question, please use the raise hand feature on Zoom, which can be found at the bottom of your screen where the toolbar is. You just click on the reactions button and then the raise hand button, and then we will call on you. Or if you're unable to do that, you can put your question in the chat. Just list your question and what your media publication is, and we will call on you, or we will read out your question. For those of you who would like to record the press conference as well, at the bottom of your screen where the toolbar is, you'll see there's an option to record to your computer, so you can do that as well. And with that, I'm going to pass it off to Natalie Mera, who's the Executive Director of the Ontario Health Coalition. Natalie?
Thank you and welcome. Thank you very much for being here. And really is tragic news that we're responding to. And, first, our heartfelt condolences to the families and friends of the people who've died and suffered health damage after giving plasma. We're going to start with Noah Schultz, who is the director of the Manitoba Health Coalition. Noah, do you want to start? We're going to be brief, maybe 3 minutes or so each, and then open for questions and answers. So Noah Schultz.
Yes, thanks, Natalie and Sala. Yeah, as has been well described already, these are really disturbing, tragic events. I want to say I'm more shocked than I am, but I think that unfortunately this was the kind of set of outcomes that we know comes from bringing profit motive into healthcare one way or another. We know that companies will cut corners potentially to make more money, and that in general, profit doesn't have a place in healthcare. So for the Manitoba Health Coalition, we're disturbed, but we know health advocates have long called for a fully voluntary system only, that we don't want paid plasma within Canada because of the risks to our blood supply, the safety and integrity of it, and crucially, the way in which paying people for plasma preys on more vulnerable populations who are going to donate more frequently because there is that strong financial incentive to do so. And these are folks who are likely to have more adverse reactions or complications. And so in addition then to the threat to the voluntary nature of our blood collection, to patients' health, to the blood supply, we know that even more extreme outcomes can potentially come from noncompliance and other failings within companies that pay for plasma, in the case of Grifols, for example. So for the Health Coalition, we're looking to ban paid plasma in Manitoba, as other provinces have done. We support the removal of the license of Grifols to operate across the country and are very concerned about what's happening in Manitoba. We also support independent judicial inquests into these particular deaths in Manitoba. We want as independent and fulsome an investigation as possible for the loved ones of these Manitobans who died, to get real answers, and so that harm like this doesn't happen in the future.
Okay, thank you, Noah. I just put in the chat the 4 non-compliance reports about the Grifols centers. And so they're there for you. I'm next going to introduce Jeff Kane. He's a retired staff person from Canadian Blood Services. We have a voluntary committee, people who are concerned about the privatization and the paid plasma situation. It's our committee to protect Ontario's blood system, and Jeff is one of the co-chairs. Jeff, please go ahead.
Thanks, Natalie. Of course, we're shocked and saddened by news that the 2 deaths occurred at Grifols Canadian paid plasma centers. The Ontario Health Coalition is calling for the immediate closure of all Canadian Grifols operated centers, and the donors be redirected to Canadian Blood Services facilities in their community. A review of publicly available records that you've been sent to by Natalie, that she's placed in the chat, revealed that recent Health Canada inspections found that Grifols did not accurately assess donor suitability, did not collect according to authorization from Health Canada, did not carry out corrective and preventive actions when required, did not thoroughly investigate errors and accidents, that operating procedures were not always followed, that the program for staff orientation or training was not sufficient, that the validation, calibration, cleaning, and maintenance of equipment was not always sufficient. This is at multiple collection centers across the country. Grifols' report card doesn't get just a B- and needs to improve. Shockingly, they failed, and more fails. Canadian Blood Services needs to end their agent relationship with Grifols immediately and accelerate their commitment to expand their own donor sites to meet the demand of Canadian patients. As the coalition has been saying since the deal was disclosed, why is Canadians' health in the hands of foreign, for-profit, big pharma? I've personally been to a number of these Grifols clinics and witnessed the harvesting of the bodies of our most vulnerable populations for profit. None of the people that I spoke to about their reasons for being there mentioned either patient needs or altruism. They all, to a person, talked about their difficult financial circumstances and the remuneration that was offered. It's un-Canadian. And what's more, it's illegal in Ontario. There's no agent's clause in the Ontario Voluntary Blood Donations Act. The Ontario Health Coalition demands that the Ford government enforce the 2014 Ontario Voluntary Blood Donation Act and shut down these reckless, unsafe operators. I think you're on mute, Natalie.
Sorry. Thanks, Jeff. The other co-chair of our committee is Sarah LaBelle, who's herself a medical laboratory technologist. Go ahead, Sarah.
Thanks, Natalie. I'm a medical laboratory technologist, and I'm just going to talk a little bit about the process for how plasma is extracted. It's a process called plasmapheresis, and what it does is it removes all of the blood to a certain amount from the patient. It then separates the plasma from the other blood products, and the other blood products are given back to the patient. Now, for a healthy individual, doing a plasma donation is not a big deal. It is something that you can safely do, but the people that are being exploited through monetary incentives are not necessarily people who are the healthiest. If you are then incentivized to donate and you donate more frequently, there is a concern about the long-term impacts of that, because even though you are getting your other blood products back, you could end up with iron deficiency anemia because there are some residual red cells that do not end up going back into the patient. So if you are frequently donating, iron deficiency anemia is a concern. And also there's a concern about immunoglobulinuria, and that's when globulinemia. That's when your immunoglobulins that actually help trigger immunity and immune response, there, because you're extracting them through the plasma as well, you may have deficiencies, which means you have the risk of recurrent infections. So again, if you're a healthy individual and you donate, it's not as big of a concern, but we know that the social determinants of healthcare are an issue, and they are very real for people who are under the poverty line, people who are, trying to put food on their table, and their incentive is to go and donate. Grifols is advertising that they will give up to $6,890 a year for people for frequent donations. So that begs the question, how frequent are people donating? And, are people turning a blind eye to the frequency because there's a monetary incentive attached to it? The company's Grifols is extracting plasma, paying for donations, but Grifols is also a, multinational, international company that's trading plasma on the international market. There's huge incentive here, and that is not what we're supposed to be doing in the Canadian healthcare system. The Canadian Blood Services was born out of a national tragedy that many, many, many people, thousands, tens of thousands of people died or ended up ill. And part of the Crever Commission said we have to increase our voluntary donor base. So that is what we should be focusing on. And all of the things that Jeff mentioned about calling on increasing to Canadian Blood Services and moving over and getting rid of Grifols is the right path, not to allow Grifols to extract plasma for monetary incentive. They got caught this time for, people getting ill and so like we need to keep an eye on it and we need to call on Grifols not to be extracting plasma. Sorry, Natalie.
No, all good. Thank you very much. So just to conclude, the CBS, Canadian Blood Services, signed a 15-year contract with Grifols. That contract needs to be disclosed. The terms of that contract, the quality and safety terms in that contract need to be disclosed to the public, especially in light of the inspection reports that have now been revealed in multiple Grifols centers. In Ontario, the centers are very new. We don't know if they have been inspected since they started operations. We need to know whether or not they've been inspected and whether or not they've been found compliant since they have started operations in our province. And I imagine people across the country would like to know that. Obviously, having your plasma harvested is safe, and that's important. It's a critical product. It's absolutely needed. And in all of the towns in Ontario where there are Grifols centers, Canadian Blood Services has centers where people can go and be assured that they are safely donating their plasma, just to be aware of that. So inspections of the other sites, disclose the contract, end agency with Grifols, come in compliance for the Ford government, come in compliance with the Voluntary Blood Donation Act, which was passed in 2014 to stop for-profit and paid plasma in Ontario. Health Canada has to disclose among the things that they investigated, the frequency with which the people who've died and been harmed have given blood. Given this other case with a man who's brought the lawsuit for alleging kidney damage as a result of equipment failure at Grifols, we need to also know more about what other adverse events have happened that didn't necessarily result in death, but did result in harm at these facilities. We're supporting the call from the Manitoba Health Coalition for an independent judicial inquest, independent from Health Canada and CBS, because Health Canada, gave the approval for Grifols to harvest plasma from a single donor up to 104 times a year. That's extremely frequent. It's not supported, or at least the meta-analysis indicates that there can be serious safety concerns with that kind of frequency of plasma harvesting. And those concerns that we have raised and others have raised need to be addressed. And I know that Health Canada gave that approval. It's double the frequency with which Canadian Blood Services can withdraw blood. And those questions need to be answered clearly by Health Canada as well. So with that, I'm just going to open it for questions from the media. Thank you. Does anyone have any questions? Okay, go ahead, Timur. Sorry.
Hi, this is Timur Durrani from the Globe and Mail. I'm hoping, can you guys hear me? Is that okay?
Yes. Yeah,
Okay.
all good.
Sounds good. I'm hoping you can sort of tell me a little bit about if you guys have any reason to believe these two people are not the only donors who have died after visits to Grifols sites.
Jeff or Noah?
I think, the bigger concern for me right now is, as Natalie mentions, we want to have an understanding of how frequently the people who did die were donating, if that connected, if these issues of noncompliance and not properly screening folks and making sure they're healthy enough to donate, if that sort of pattern is happening in Manitoba or elsewhere. At this time, I have no, insider knowledge of other people who may have died, but what we do know is that there are folks like the Manitoba man from, I think, 2023 who alleges he suffered kidney damage. even people who are supportive of Grifols. I was reading a good piece in the Free Press about this, and people who donate to Grifols or have their plasma harvested were saying, I'm not deterred by these harms or these connected deaths, perhaps. Um, Mostly I'm fine. The worst I've had is a mild fever or something like that. And even that is a little bit troubling. It's like those kinds of instances are being sort of brushed off by folks because they are in such dire financial straits, because it does incentivize to give more often with those kind of frequent donation bonuses. So and even if people were not dying, we have a lot of reason to be concerned about the pay per plasma model. And so I think we have really deep concerns, and then we have these extreme tragic cases, and I have no clear understanding that more people have died, but certainly one is more than enough, one is too many.
Okay.
Um,
Noah, there's a sign behind you with profanity. Someone is asking if you can remove that for
oh,
broadcast.
sure. My opposition to fascism notwithstanding, I'll quickly block that. Hold on.
Thank you. Yeah, Jeff, I just wanted to note that in the inspection reports, and maybe Jeff, you're going to talk about this, but there's reference to not following proper procedures for adverse events. And so that certainly raised some flags for us. What were those? And what kind of qualitatively, how serious or not serious were they? And again, there's no information about that. But Jeff, go ahead.
I was just going to say we don't know what has been the effect of these non-compliances on the people that have gone there to sell their plasma. It's taken so long to hear about these two deaths that we're not sure what's happened. And of course, there's a lot of things that can happen other than mortality from these donations. Folks can have adverse reactions and need medical intervention, etc. And I think we need to know about the training of these staff and their qualifications. And as the compliance report showed, Health Canada has concern about them as well.
Okay, thank you. There's a question in the chat from Sheila. Sorry, let me just get to it. How often should clinics be inspected? Is there a standard? Jeff, do you know?
Sorry, I'm not familiar with Health Canada's standard for the number of. I think we did see in there in the notes that the follow-up from these inspections that they do schedule those, but I don't think they announce them.
Okay. Any other questions? Okay, go ahead.
Yeah, I wonder, the other question is like, who in your opinion holds the responsibility of vetting donors at plasma donation centers? You guys have talked about this, of course, this is their responsibility. But I wonder, part of this is because even our healthcare system, say if you go to, an ER and things, they assume certain things that you're going to report appropriately, right? Like you're not going to be lying about them, but they also verify those things, right? This seems to not have been the case at a lot of these sites, and hence the non-compliance there. I wonder if you think that's also part of the problem, the idea that vetting is not happening appropriately because they're not verifying the claims of these people who are wanting to donate.
Jeff?
Yeah, the problem is that the motive for is for money. That there is no incentive for Grifols to deny a donor when they could be making money from selling their plasma. Whereas in the public funded and responsibility for blood collections, Canadian Blood Services, there is a rigorous uh, 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 processes that go into determining if a person should be donating, and the follow-up too, when after their donation has been tested medically with their own family doctor, etc. So the problem is that it's for profit uh, handling our healthcare.
I think also, long before these centers were allowed to open in Canada, Grifols was already quite controversial in the United States for setting up plasma collection centers near the Mexican border. And Mexicans from the maquiladoras, so very poor people, were able to cross with day passes and then be bused by the companies to these plasma collection centers and be paid for them. And the frequency was an issue. The screening of the donors was raised as an issue. All of these issues were raised before this even started in Canada. So, and it was one of the reasons why all of the people who raised concerns about this in Canada were raising the concerns. Now we see the inspection reports and we can see that there's a pattern of the types of things in which they're not compliant. And one of them is screening donors, an issue that's long been raised as a problem. And the question is, what's in the contract? What is there to protect the public interest? We need disclosure of those things. Obviously, when you're not dealing with a for-profit company, you're able to have a lot more transparency. And at this point, I think that it's in the public interest that we demand that transparency about what's happening. That contract needs to be disclosed. And we need to understand what the consequences are for non-compliance, because so far there really haven't been any, it appears.
Natalie,
Yeah.
just the updated note that Grifols put on their website about updating the donor frequency says starting March 9th, 2026, you need at least 48 hours between consecutive donations. The 2 donations in 7 days still applies. When booking your appointment, please ensure you follow this guideline. And it's interesting wording because it's expecting the patient or the person who's coming to donate to be following the guideline rather than Grifols saying we will be enforcing this guideline and through screening, right?
Right.
Like, I think that's kind of important to note.
Totally. No, sorry, go ahead. Yes.
No, and that just fills in, right? I mean, as Jeff said, right, the financial motive is so clear, that incentive. And so unlike when people are donating for altruism to support, patient needs, if people are donating because that's their survival money, of course they have an incentive to self-screen themselves in, even if that's not appropriate. And I don't think we want to leave that to those vulnerable individuals to somehow blame them for not disclosing when there are such clear material incentives to say, yes, I'm perfectly well to do this. And that's again that perverse profit motive.
I would
And
also,
just to know, sorry, go
I was
ahead,
just
Jeff.
going to say, the question about what's the resolution or what's how can we solve this is to enforce the Ontario Voluntary Blood Donation Act. It's an offense to pay or offer payment to blood donors, or for even donors to accept payment for blood or plasma. That's in the Act. It should be enforced. There's no agents clause that allows Canadian Blood Services to employ or have a contract with an agent to collect on their behalf. The only reason that is in there, that Canadian Blood Services is allowed to pay, is if in the event of catastrophe, war, etc., where patients' lives are at risk. That isn't the case here.
Thanks, Jeff. So the just for the media, that update on the Grifols website, brings it in line with what Health Canada approved them to be able to do. So the more frequent donation that was on the website before that was wrong. I don't know whether why that would have been, but the fact is they just corrected it to just come in line with what Health Canada, the very frequent donation that Health Canada is allowing them to do already.
And I just saw a question in the chat, Natalie, for me about how we plan to continue on with our advocacy about this. If I can just
Thank
sort of
you.
take it away.
Please.
And so there's 2 pieces of what we're calling for in Manitoba directly in sort of urgent response to this is the ban on paid plasma, and then also this call for judicial inquests. And where I've been really happy with the province's response so far, I think they're taking this seriously. The health minister has recently made comments into the media suggesting there's an openness to pursue or consider at least banning paid plasma. So I think that's a really good start. We would like to see more urgency on that, but still there's a willingness and a clear taking seriously of public safety here. So there's a political role for the federal, or sorry, for the provincial government within the province to ban this because the province can't take the license away. That's Health Canada's responsibility. But we can't really pressure the health minister to then call for these inquests. That's up to the chief medical examiner. And so I don't think political interference would be appropriate here. But as far as our ongoing advocacy, I've certainly been in contact with folks from the health minister's office, and I'm always eager to meet with the health minister about how we can improve public health care in Manitoba. And so we'll be watching this closely. We'll be continuing to push for our calls to action here, the ban and the inquests, and participating with other coalitions and advocates across the country because this is an acute problem right now in Manitoba. We've had these two suspicious deaths, including an international student at 22 years old who reports suggest her heart stopped while giving plasma. This is tragic and very disturbing, but even across the country, we support ending this predatory practice and rebuilding and expanding the voluntary system that is much safer and equitable ultimately.
Any other questions? Thanks, Noah, for that. Okay, go ahead.
Hi, sorry about that. I just have one more question.
Oh, no, it's good.
Get in there.
I wonder, you know, and this is something that a lot of people have sort of been worried about, I think, as well, right? When it comes to paid plasma and the reason for why these donation sites even sort of came to be, particularly in Canada, is, you know, I wonder what your thoughts are on this. Do you think enough people would be part of a voluntary donation model to then collect appropriate amounts of plasma for our healthcare system's needs as well? I mean, of course, their entire spiel with Canadian Blood Services was that they would do both things. They would do their own whatever they need to do outside the country, which we've also reported the Globe, like, and you know, that kind of a thing. But then also, of course, they are helping the Canadian Blood Services system within Canada, right? And that's sort of part of the appeal, or so has been, at least for Ontario and other provinces, to allow this to happen. And I wonder, again, do you think enough people would be part of a voluntary model then, if we only went with that and then there's no paid blood plasma happening in Canada?
Okay, I definitely have an answer for that, but I'm just going to ask if any of the speakers wants to address it. Jeff, Sarah?
Yeah, I will. There is capacity to increase the voluntary donor base across the country. And it starts with more donor centers and upping the awareness of people. Like, workplaces can do drives, right? Like, why can't you say we do drives for the United Way? Why can't we say, hey, let's do increase and have this month we're going to do, everybody who works in the workplace can do a plasma donation. In Ontario, we did, you know, the exact opposite. In 2012, we closed a plasma donation system in Thunder Bay. It has since reopened in 2025, but you know, for an organization that was supposed to be actually upping the donor base in Canada, the voluntary donor base after the Creever Commission, we did the exact opposite. So there is capacity to do those things through education to our, right now, we have a shortage of kidneys. We don't sell kidneys to solve that solution. We have a very public advertising campaign that says we need people to donate their organs so that we can save lives. And you can do that in the voluntary donor base as well. And it's upping advertising, upping the collection centers, you know, increasing the hours where you can, where there already are collection centers, instead of doing the exact opposite like we did in Ontario.
I think that from the very beginning of this, we've all wondered, where was the campaign? Where was the big public campaign to push for voluntary plasma donation? You know, we all know what that looks like. You know, it looks like working with corporations, with banks, and so on, doing drives in workplaces, advertising, etc. There has been advertising for sure for blood donation. There's not been the same kind of mass campaign that one would expect, you know, prior to the worst possible scenario, which is handing it over to a multinational for-profit company that was already controversial, and in which they pay and then they give bonuses for people who give their plasma more frequently. mean, every warning was against that. And so we've gone in the opposite direction. I'll say in Ontario, apparently we have, more than $100 million to pay for advertising paid by the public to tell us that the government's doing a good job on healthcare. Could we put at least some of that towards building a voluntary blood products donation, plasma donation? It's not that the possibilities, the depths of the possibilities for building a voluntary donation base have been plumbed here. Not at all. Okay, Gavin?
Hi, can you hear me okay? Sorry,
Yes, we can.
perfect. This is just a question for Noah. I'm Gavin Oxford with CBC News, by the way, just in case. I'm just wondering, Noah, just for people who might see some of this coverage today, are you able to explain sort of what the benefit, I guess, would be to having an inquest into these deaths would be, just for people who may not understand?
Well, yeah, I mean, we see this as a really important tool. These inquest mechanisms are there in part in suspicious deaths where there's a public interest in knowing what happened, where we want to have clear guidelines to prevent these kinds of harms in the future. We also, I think, within the Manitoba Health Coalition, we support these more independent inquests. This has been emphasized already. Health Canada has a relationship with Grifols, licensed them, has agreed to some of the practices that seem to be causing harm, or at least the pattern of noncompliance doesn't seem to be having consequences for them. And so we do feel that a more independent investigation within and run within Manitoba in particular would be appropriate in this case to bring truth and hopefully some justice for the friends and family of these people who died. If anything, truly untoward happened, we want that to be uncovered. We want to know what conditions in the collection sites may have contributed, whether it's poor screening, you're not doing the calibrations correctly, you're not training staff. And so I think we really just need that fulsome understanding of what happened so the public has an answer to this, and so that the government also has a clear understanding of what needs to be done about it legislatively, politically.
If I may, the people, our members and supporters who were involved in Blood Watch since the tainted blood scandal really raised that we need to call for independent investigation, independent of Health Canada. We have had an experience before, as you know, in Canada, in which there was cover-up of dangerous practices and flaws and failures. More, I should say, more of flaws and failures. And so for the confidence in the blood system, and for the confidence of those people who have closely watched and monitored these issues for decades now, the belief is that we need an independent, obviously Health Canada needs to investigate, obviously CBS needs to do its job, but also we need independent investigation to ensure that there is appropriate accountability.
Yeah, that's so important too, that this call, for the Health Coalition, we are always trying to work in collaboration with experts, with people with experiential knowledge, with activists. And so we're also following that directive or that encouragement to call for these independent inquests for people who have, decades of experience in this work. We trust that expertise as well. So yeah, thanks, Natalie.
Thanks. Any other questions? Okay. Oh, thank you very much. No, thank you for joining this call. It's really important. And just once more, because we're talking about real human beings whose lives have been cut short in ways that are just hair-raising to all of us. Our condolences to their friends and family, our heartfelt sorrow for their loss and for the people who have been harmed. Thank you.
Yes, thanks everyone.